I'm with Maria Perno Goldie. She is the owner of Seminars for Women's Health in the San Francisco area. She is also the editorial director for RDH eVillage Focus. And hello, Maria. How are you?
I'm just fine, Mark. How are you doing?
And RDH eVillage Focus comes out on the first and third Friday of each month. Maria, I wanted to ask you about the Institute of Medicine. They came out with their report Advancing Oral Health in America last week, and I'm sure many dental professionals are aware that the report is out there. I was wondering if you could comment on what they should be aware of as they look at this information.
Sure. The Institute of Medicine report was released on April 8th, so almost a week ago, and it was commissioned by the Department of Health and Human Services. And it builds on Oral Health in America, which is the Surgeon General's report that came out in 2000. And basically what this is a call to action. You know, in 2000, the report came out, and I don't really know that we've made a ton of progress in the area of oral health, and they want to call attention, especially in the area of public health, where, you know, this is an area where, of course, you know, 80% of the problems are in 20% of the individuals. So, and they also, excuse me, Mark.
Bless you.
They also want to talk about overall health, you know, the oral systemic link, and, you know, talking about research and evidence-based care as the foundation for education in dentistry and dental hygiene.
It seems like I've seen some comparison to the Surgeon General's report from, I guess, 10 years ago? Do you think it's fair to compare the impact of this document with that, or is it?
Well, I think basically what it's doing is building upon that, really saying, you know, we've had this report for 11 years. What are we doing about it? It's really a call to action. So it's just kind of heightening awareness and making us more aware of the importance and the value of oral health. And it wants to really raise the profile. It's trying to get oral health back into the public eye, into the eye of policymakers and officials, so that when we're talking about research dollars and things like that, that we'll be able to, you know, be aware of what's needed out there. There actually were 7 recommendations in the report that are considered kind of new as well. So, you know, they're talking about evidence-based services, whether it's in clinical practice or community-based practice. They're talking about oral health literacy. I mean, a lot of the problem with people accessing some of the programs that are actually in place is they don't know they exist, they don't understand English. So literacy is really, really important, not just for individuals and communities, but also for healthcare professionals. And, you know, education, training, all of these kinds of things are really, really important, as well as interprofessional relationships. Because when we talk about the oral systemic link, we're not just talking about dentistry and dental hygiene. We need to be talking about general medicine, nursing, physician's assistants, you know, because when you look at some of the things that affect oral health and oral health affecting other systemic things, it's not just us in the oral healthcare professions, it's us in the medical professions.
Yeah, and it would increase more interaction between all of the professions.
Absolutely.
Yeah. Maria, I know that in addition to everything else you do, you are the president of the International Federation of Dental Hygienists. I know the next meeting is in South Africa in 2013.
Correct. August of 2013.
And so has there been anything happening with the association since its meeting last summer in Scotland?
Yes, well, the Executive Council meets every month by Skype, and we actually just met in person in conjunction with the International Association for Dental Research. So we are constantly trying to implement the actions of the House of Delegates and to do the administration of the association in between the 3-year meetings. The South African Dental Hygienists Association have already created a website. They're called the Oral Hygienists Association of South Africa. And we, as IFDH, will have our new website up soon. But if you go into the website of the Oral Hygienists Association of South Africa, you can actually get a link to the 2013 meeting. There's not a lot of information up yet, but they're taking names, and you can sign up for email updates.
Okay. Well, I know you mentioned the House of Delegates action that in Scotland, and I know there was some objectives outlined at that meeting in Scotland. Do you think things are going well or progressing well with?
I think we are. We have our goals of the IFDH, and then we have our mission and our goals, and then the House of Delegates has 3-year goals that we set up. So I think that, as we work, we're implementing some of the actions that were taken, and all of them affect goals in one way or another. So we are making progress. As I said, we're getting a new website. We have our International Journal of Dental Hygiene, and we have a brand new editor. So we actually met with Kirsten Oren in San Diego, and we're forging an even better relationship than what we had before, because it is really our publication. And we actually are now an index publication, so it will attract academicians and researchers to publish in that journal. So that's a very exciting piece of news. And then the fact that the South Africans have really moved ahead very quickly, we're very happy with that. So, yes, we are making progress.
Well, I admire all that you do to bring the hygiene community together on a global level, so I congratulate you on that. Again, I hope everything goes well with the next issue of eVillage Focus, and thank you for your time.
You're quite welcome, Mark. It's always a pleasure. You have a great day.
Bye-bye.
Bye-bye.